वेलकम टू हेल्थ टॉक लाइव टॉक शो। जैसा कि आप सब जानते हैं, health is wealth and precaution is better than cure. Let me introduce my co-host, Dr. M.S. Cover. He is pulmonary and critical care specialist and senior member COVID team from Indraprastha Apollo Hospital, Delhi, one of the best hospital in India. Welcome to the show, Dr. Cover.
Thank you, Rashmi. It's a pleasure to be on your show again.
Thank you
And
so much, Dr. Cover.
today we'll have with us among ourselves Dr. Monica Chib, who is senior consultant in psychiatry in Apollo Hospital, and she has huge experience in dealing with all kinds of disorders. I mean, starting from anxiety disorders to schizophrenia and all that, and the kind of anxiety that probably has engulfed people during the COVID times the last year and a quarter. The problems have been compounded, and we anticipated that when the things were becoming hot with COVID in the spring and early summer of 2020. We knew that the way the people were reacting and asking us questions, we knew that they'll probably be having more and more psychiatric issues or psychological issues in times to come. And that is exactly what happened. And probably this was a global phenomenon. It happened all over. But Dr. Monica Chip would be able to highlight those issues in the Indian context. Dr. Chip, what kind of common problems you encounter in your day-to-day practice? I mean, with or without COVID as a background, but what kind of common problems, which are day-to-day problems, and you feel that you need to really come out open in the public or through a TV channel and advise people in general. People may not come forward to you or to a psychologist, but they would still be able to imbibe a lot from your talk and be able to apply some of those things in their life.
Thank you, Dr. Kamar. Thank you, Dr. Rashmi, for giving me this opportunity to talk to you.
Welcome, Dr.
I think
Monica.
the biggest problem we face is depression. Depression in its myriad forms. Uh, Straightforward depression is very easy to diagnose, but depression comes in a lot of hidden forms. Like we'll get a patient with multiple somatic symptoms, physical symptoms, which could be depression, a manifestation of depression. Then we have a lot of anxiety. We have a lot of what is termed as obsessive compulsive disorders, which in Hindi we say vehem ki bimariyan.
जी.
And of course, we have our fair share of psychosis, but I would say depression and anxiety carry the biggest load that we see.
So, how do we know it's depression or anxiety? What are the symptoms? We would like to know about that also.
Uh, Depression or symptom, Rashmi, have very similar symptoms. So it's very difficult for a layman or even sometimes a general physician to diagnose. दोनों में चिड़चिड़ापन होता है, दोनों में किसी चीज में मन नहीं लगता, दोनों में sleep can be disturbed, your appetite can be disturbed, you may not be able to focus on your work. So we sometimes have what we say tests that we carry out, or when we take a detailed history and we ask the family members also for corroborative history, तो उनसे फिर हमें पता चल जाता है, and also the patient's personality. You know, are they the worrying sort? Are they very anxious? Are they very thing? तो उससे अंदाजा लग जाता है.
Okay.
Yeah. Uh, do you think that a lot of times anxiety in the initial phase leads to depression? Of course, it leads to sleep related issues, as you mentioned. and sleep disorders are becoming part of their life. They often start with anxiety and end up with insomnia. Insomnia is sleeplessness, Rashmi. But how often do you see these initial anxious patients ending up with classical depression and even suicidal tendencies?
Very often. Because if the anxiety is not caught and treated in time, it just grows larger and larger and larger. And then it becomes difficult to handle and leads to depression. In our field, we say anxiety and depression go hand in hand 60% of the times. So, very often, anxiety can give you depression in the later stages.
Yeah. And how frequently do you see these cases? I mean, do you think the numbers during COVID times have increased, or have they been in touch with you
Definitely.
through video consultations? Because these days we have been doing quite a few video consultations because we are not allowing our patients themselves don't like to come to the hospitals easily for fear of catching any infection from some other patient who might be carrying COVID. So you might be doing a lot of video consultations. And do you think there is a change in the pattern or increase in the numbers of these patients?
Yes, of course, Dr. Kamar. Anxiety has grown up to, I think, almost 41% from what we used to see it in normal times. People are so scared of the unknown. This COVID has come as a totally unknown entity. First, everyone was scared about catching it, and because of the fatalities that were there earlier, people really got scared. Then, not knowing how long it would be, how and because of the COVID, we had the lockdown, so your whole life was disrupted. Whole life, as you knew as normal, was disrupted. You either lost your job, or you were working from home, or you got a cut in your salary. So there were a lot of economic stresses. Then you were isolated at home. A lot of people couldn't go out. Lockdown came very suddenly in India. So a lot of people were just left in hospitals or left in PGs and all, where they couldn't go back to their families. So isolation led to a lot of anxiety, not knowing what to do, no one to turn to for help, no one for support. Then for families who were cramped together in small houses, being on top of each other 24/7, that led to a lot of stress, which led to a lot of frustration, and your anxiety grew. So COVID brought with it a lot of problems. I mean, we have termed it as a quarantine paradox. I mean, the lockdown helped the spread of COVID, but it brought along with it a lot of negative mental health issues,
You're perfectly right on that. Yes.
social disruption. So it came with a lot of negativity also.
Yeah. Even people who are working from home, I mean, they are not a happy lot. I mean, they may be spending more time with their families at home, with their children at home, but their work schedule, the timings have altered so much, and now there is a lot of gray
Fixed
areas.
hours.
There is
There are no fixed hours for working
no
from
fixed
home.
hours, no
You
fixed
could
hours.
be on call anytime. I mean, your boss could send you a message. Plus,
Yeah.
um, let's be very practical also, Dr. Cover. People were working from home, so they needed internet and something, a phone or an iPad or laptop to work from. Then the children's schooling started online, so everyone
Yeah.
else also needed.
Yeah.
And people in cities, I mean, the general population doesn't live in large mansions. So there's very limited space for, say, two working adults and two children who are studying online to have room and space for them to work. It's not possible. So you're on top of each other. And if you're working from home and you have small children, they don't understand. They just know Papa or Mama at home, and they'll go up to them and disturb them and all, and you can't do anything about that.
Yeah, that's right.
So
And
working from home is not easy.
But
no,
Dr. Monica, a lot of people feel very embarrassed, taking their kids to the doctor, and they feel like, and even their kids are not comfortable. If that situation is happening, so what should they do? Like, कैसे वो लेके आए कुछ उसके बारे में आप limelight दें, because a lot of people have been texting me non-stop that
See,
it is of course
आजकल
happening as you
Rashmi,
told because of the COVID time also. It's more now.
Actually, because of COVID, a lot of our consultations are online. So it's very easy to introduce a child to a physician or a therapist or a doctor online because that scare of going to a hospital with its connotations of injections and things like that is not there for the children. No? So if you're meeting an uncle or an auntie online who's going to be talking to you, asking you questions, that's not as threatening as going to a hospital. So
So, Dr.
that's
Monica,
very.
how you treat your doctor? Like, if you have a patient who has a depression, so how you treat that patient?
पहले तो उनकी पूरी फैमिली हिस्ट्री सोशल हिस्ट्री सब कुछ ले लें so that we understand what is happening in their lives. What are their stressors?
Uh-huh.
What is causing them problems? Is there any stressor or not? What their family condition is, what their social condition is, what their professional condition is. We need to know that in detail.
Uh-huh.
And once we have that and we've made a diagnosis, then according to what the factors are, we would either suggest कि आप counseling कराएं,
Uh-huh.
और we would say कि नहीं आपकी डिप्रेशन थोड़ा ज़्यादा है तो शायद आपको दवाइयों की ज़रूरत है.
Okay.
But very often we treat them with medication and therapy. So it's what we say a combination. And we advise them आप थोड़ी exercise करें, yoga करें. I normally tell my patients that depression के लिए 5 चीज़ें चाहिए. ये 5 उंगलियां जो हैं उसकी drugs, therapy, occupational therapy, social interaction, exercise. All these 5 things are required to treat depression properly. आपको अपने आप भी थोड़ी कोशिश करनी पड़ती है. You don't feel like it, you're too lethargic, you don't have the energy, you don't feel like you can do exercise. But try. 10 minute की walk कर लो. We are not asking for much. Start
Mm-hmm.
with 10 minutes. Gradually increase 15 minute, 20 minute करो. Slowly you'll find that you can. Because when you exercise, Rashmi, the body actually releases hormones, endorphins, which help fight depression. So that's why exercise is very important as a part of treating depression.
Fantastic. So,
yeah,
Dr. Cover, yoga and fitness really matters a lot, right? It's so important for our life.
yeah. See all the de-stressors that she has mentioned. Even meditation. Even
Yes.
meditation is a de-stressor. People who can spend time and temporarily elevate themselves into a different world. A more but a different platform. Then they
So
gradually
for
learn
people
to
with,
they
I was just
gradually
going to say
learn.
for,
Sorry, please go
sorry, I
ahead.
keep interrupting you. Yeah, I was going to say that people with anxiety, we definitely advise them to do yoga, pranayam, and all because breathing exercises really help bring the anxiety levels down. And if
Yeah.
you're doing regular yoga, you can help calm your mind as well as your body. So you can take control of it. So that is a very important part of our prescription.
Wow.
Dr. Monica, what do you think is the fine line between a psychologist consult or a psychiatrist consult? Because often people ask us about that. Should I see a psychologist? Should I see a psychiatrist? Though you have actually explained that indirectly in a way, but can you elaborate that a little bit more clearly?
Yeah, a psychologist is generally an art student. They've not studied medicine, they've studied human behavior, they've learned how to uh, find out abnormal human behavior and how to test it.
Mhm.
So they are not doctors. except people who've done their PhDs in psychology and then they can call themselves doctor, but they're not medical doctors. They can't prescribe
They
medication.
cannot.
Doctors, I mean, psychiatrists are basically MBBS who have then done their post graduation in psychiatry. They also know how to treat abnormal behavior. They also know how to counsel patients. But the main difference is they can prescribe medicines. Psychologists can't prescribe.
Oh, okay.
But sometimes, if we want to test somebody for various things, like if we want to ensure the child does have attention deficit disorder, or they do have any personality problem, or they do have any psychotic problem or a mood disorder, then we refer them to the psychologist who will carry out the test. And normally, counseling is done by the psychologist, the therapy part of it, because unfortunately, psychiatrists don't have that much time to spend. Therapy
Okay.
takes a long time.
Yeah, how many
Yeah.
sessions or how many settings are required with a patient who is going through depression or anxiety? Is there any time phase, or you just
No,
can you
no,
don't know?
Rashmi. It varies patient to patient. Minimum would be 8 to 10, but it varies from. You have to tailor make it for every patient that you see. So there's no fixed rule. But there are some certain therapies which say, okay, 10 sessions, 12 sessions, like that. But otherwise, it can carry on for months. Therapy is like yoga. You don't get immediate results. You have to be consistent because in therapy, very often you're being asked to change the way you look at things, the way you think, the way you perceive things, and that takes time. Your change doesn't happen overnight. So, what we have one special kind of therapy called cognitive behavior therapy, where we train them to relook at their thinking, the way they accept things, the way they look at things. And to bring about a change takes a lot of time. It's not something you can accomplish in 6 sittings or 8 sittings.
Okay. Dr. Kavar, it's good to
Uh,
know, right? So many
yeah,
knowledgeable things, and it will be a great help for our viewers today.
yeah, absolutely. Dr. Monica, do you think in these times when the stresses have increased so much, we know that the anxiety and the depressive disorders have gone up uh, in quantum leap. But have you also seen any change or increase in let's say psychotic disorders or bipolar disorders? Have they any
Yes,
relation with stresses?
absolutely. Stress does bring on, can precipitate a psychotic episode or even a bipolar episode, a manic episode. And the worst part, Dr. Kanwar, was in the initial stages of lockdown, where everything was shut. People who already had psychiatric problems, who
Mm-hmm.
already had psychotic illnesses, they could not reach out for help because by that time the online things hadn't yet started. Everyone was
Yeah.
still floundering, learning how to deal with the situation. So they got a lot worse. They couldn't go into hospitals. Initially, medicines were also a problem. But slowly, slowly, as we found our way, we started online sessions. A bit of movement was allowed later on for the health workers to go and attend things. So those instances came down. But stress in any form can precipitate any kind of mental disorder.
Yeah. Can you also tell us something about the OCD? Just because this is also a psychiatric illness and is so
Yes,
common. It is so
very
common, and
common.
people don't realize that it is a there is something wrong with their thinking, and they are compulsive, and obsessed about things. Can you please explain so that some of the viewers may be helped with that?
Okay, now if we take the full form of OCD, it's obsessive compulsive disorder. So if we talk about obsessions first, these are repetitive thoughts or actions that come to your mind. You know they might be very silly, but they are so strong you can't get rid of it. The commonest one is कि मेरे हाथ गंदे हैं, यहाँ गंद है, मैंने हाथ धोए हैं लेकिन अभी भी साफ नहीं हुए, मैंने कपड़े धोए हैं तो वो साफ नहीं हुए, मैं बाथरूम में गई हूँ, वो गंदे पानी का छींटा मुझे पड़ गया है तो आई मस्ट bathe again, I must bathe. And they keep doing it. They spend long time doing it. This is the commonest form, I'm saying. Or it could be मैंने दरवाजा बंद किया था कि नहीं, मैंने गैस बंद करी थी कि नहीं, रात को डोर लॉक किया था नहीं. So you keep going back and forth because you're never reassured कि ये मैंने कर लिया. You don't have that confidence. So this repeated checking, all these intrusive thoughts, repetitive intrusive thoughts that come to your mind, these are obsessions. So what people do is this, and it causes a lot of anxiety, because how many times are you going to go back and forth to check whether you've shut the gas off or whether you've locked the front gate or whatever, or whether your hands are really clean? So it causes a lot of anxiety. Now, to control that anxiety, people start doing actions which makes them think, Acha, if I press the light switch 3 times, to theek hoga. So I must do it 3 times.
Oh.
Or if I wash my hands for 10 minutes, so that is the compulsion, that I must wash it for 10 minutes. That thought which drives you to do an action is the compulsion. The action is the compulsion. So as long as everybody has some eccentricities, everybody has some kind of thinking that may be a little different from others. But if that thought or that action interferes with your day-to-day life, it prevents you from leading a very productive life, it interferes with your work, it interferes with your personal life, it interferes with your social life, then it's definitely a problem and it needs to be treated. I mean, I had a patient who जिसके घर में 15-20 साल से खाना नहीं पका था, because she used to think कि किचन गंदा हो जाएगा और मैं खाना फिर वहां कैसे पकाऊंगी, तो वो सारा टाइम किचन अपना साफ करती रहती थी, and she wouldn't allow anyone to cook. Luckily, her husband was earning at that time, he could afford it, but when they came to me, he was due for retirement and his daughter was due to get married. And he was saying कि डॉक्टर साहब अब मैं कैसे अफोर्ड करूं बाहर से खाना मंगवाना, 15 साल से हम बाहर से खाना मंगवा के खा रहे हैं, लेकिन अब तो मैं रिटायर होने वाला हूं, so how will I do it?
Of course.
So this was a really severe case of OCD that we had. And people don't feel that there's anything wrong. नहीं, वो तो गंदा है, उसको साफ करना है. नहीं, आप नहीं समझते.
Absolutely.
Yes. That's absolutely right. Yes. Rashmi, any thoughts you have?
Yeah, I do have one question actually. उनका मुझे स्पेशली फ़ोन भी आया था हमारे स्टूडियो में. She wanted to ask that उनकी 3 years old, she has a daughter, and she is taking care of her from almost an year. She is with her at home. उसका husband, he's working. So she is into a phase of depression like that. She feel like she has nothing left in her life. So in this situation, what she should do? Of course, बच्चे की टेक केयर तो करनी है, लेकिन उन्हें क्या कर सकती हैं और कैसे वो इस डिप्रेशन से बाहर आ सकती है? She is having lot of negativities right now.
So first of all, she should find someone to talk to and share her problem with, whether it's a family member, whether it's a friend, whether it's some kind of a support group. And then she should go online, or if she's going outside, try and find a counselor, talk to a counselor, talk about her feelings, her negativity. And if her negativity is so bad that she can't cope with anything, or she's suicidal, or she feels that, she just can't do anything more, then maybe see a psychiatrist and get on medication.
Okay, so that will help her out, right, in this situation?
Yes, definitely. Because mild depression के लिए तो आप therapy से काम चला सकते हैं.
Okay.
But अगर moderate या severe या major depression जिसे हम कहते हैं, उसके लिए तो दवाइयाँ की ज़रूरत पड़ेगी ही पड़ेगी.
Absolutely. So that was a great information, I'll say, for her, and if she is watching our show, so she'll be very happy. So it's amazing, Dr. Cover. We have so many people who are so knowledgeable around us, and I feel ki the knowledge they are sharing with our viewers, they are benefited so much. So thanks to our virtual platform, I'll say, because of that we can connect to people across the globe. And thank you, Dr. Monica, for your time कि आपने इतना कुछ
Thank you.
बताया. And
There's
thanks to
just one
Dr. Cover.
last thing I'd like to say, Rashmi, that people still hesitate coming to a psychiatrist because they don't want to go to a Pagloka doctor because they feel there's a stigma to it. And so they suffer with anxiety
Yes.
and depression for so long
Yeah.
because they feel that, just going to a psychiatrist will stigmatize them. So I want to convey to your viewers that psychiatrists are not Pagluka doctors. We
Yes.
are here to help you with your problems, with your day to day stressors in life, to teach you better coping skills. All of us develop some faulty mechanisms about coping strategies and things like that. So, just to help you and give you someone to talk to who will understand you and help you get over your problems. And we don't give shocks unnecessarily, and our medicines will not make you into zombies, which is the fear most people have.
Of course, yeah, of course, yes. Good to know.
And Dr. Monica, the other good thing is that now you are able to reach out to them through video
Yes,
counseling, video consultations, video conferencing
Absolutely,
and stuff.
absolutely. And
So
we
so
send
they
our
don't.
prescriptions online. They can get their
Yeah,
medication.
yeah.
There's no problem.
So you don't
There's no
have they don't
problem.
have to come and line up in your office, and wait for you and be seen to be waiting for you.
absolutely.
So
And they don't have to
No,
so
feel
they
they can
still
embarrassed.
have to get
Virtual
they,
an
sessions will be
appointment for
great.
online
yeah,
consultation.
yeah. Once they do that, they can do it from the living room and talk to you.
Comfort of their
So
homes.
so
Yes,
much easier for
so
for
much
for
easier.
them for them.
But there's a
Um,
downside to these online consultations also, Dr. Cover, because they're calling in their bedrooms. Very often you'll have somebody sitting in his ganji or sitting in their nightie, and you have to tell them, please, this is a formal consultation. You need to be. So there's a
yeah,
downside to everything.
yeah, that's right. Yes. Well, it's very nice information you have given, Dr. Monica, and I'm sure the viewers are a lot benefited, and those who have some kind of issues of this sort, they would be glued to the TV, trying to imbibe whatever best they can. And yes, it's very clear that they shouldn't hesitate to
Absolutely.
go to a psychiatrist or at least a psychologist when the need arises,
Absolutely.
rather than keep it within themselves and let it become worse over time.
Fester.
So that
Let
is
it
very
fester and
important,
become more severe.
more severe.
एब्सोल्युटली एक
Yeah,
अच्छी ज़िंदगी जीने के लिए हमें फिज़िकली और मेंटली दोनों तरीके से फिट होना बहुत ज़रूरी है एंड दैट इज़ रियली इंपॉर्टेंट. एक अच्छी सेहत होना बहुत ज़रूरी है जिसे हम खोने के बाद उसकी अहमियत जानते हैं. सो इफ़ वी टेक केयर ऑफ आवर हेल्थ वी कैन रियली लिव अ गुड लाइफ and quality
yeah,
life, I'll say. So thank you,
yeah.
Dr. Chib. It was great talking to you. But before we end the show, any message for our viewers?
Like I said, please don't hesitate to talk about your mental health. It's as important as your physical health, it's as important as your spiritual health. So you need to take care of all.
Thank you. And Dr. Cover, any message from you
Thank you.
also for our
Well,
viewers?
I mean, today is Dr. Monica Chip's day, so the message has to come from her, and she has very clearly elaborated that. So, uh, thank you so much, Dr. Monica, and thank you so much, Rashmi, for being such a gracious host, as always.
Thank you, Dr.
Thank
Cover.
you,
It's
Dr.
always nice
Kawar.
sharing
Thank
screen with you. Thank you, Dr. Chib. Thank you, Dr. Cover. Thanks a ton for sharing your knowledge. Thank you so
Thank
much.
you.
Thank you,
Thank you.
viewers.